My name is Miranda Siemienowicz. I am a thoracic radiologist at the Northern Hospital in Melbourne, Australia. I am the chair of the Australian and New Zealand Society of Thoracic Radiology and the clinical lead for the National Lung Cancer Screening Program on behalf of the Royal Australian and New Zealand College of Radiologists. Eligible people are now able to participate in screening for lung cancer with the National Lung Cancer Screening Program. Lung cancer is Australia's leading cause of cancer death, with almost 9,000 deaths recorded from this disease in 2024. Most lung cancer is diagnosed at a late stage when treatment options are limited. The 5-year survival of stage 4 lung cancer is below 5%. Without screening, only about 16% of lung cancers are detected at stage 1, when 5-year survival is around 70%. By targeting asymptomatic individuals at high risk for lung cancer, the National Lung Cancer Screening Program is expected to save hundreds of lives each year by finding lung cancer early when treatment can be effective. This Australian government program is our first population-level screening program since 2006. It is also the first radiology-based screening program since 1991, and as such represents an incredible milestone for our profession. Eligible individuals are those aged between 50 and 70 years with no signs or symptoms of lung cancer. The program targets those with a smoking history of at least 30 pack years who are either currently smoking or have quit within the last 10 years. You do not need to quit smoking to have your scan. The scan is free, covered by Medicare, and as radiologists well know, is painless and only takes 5 to 10 minutes to complete. Lung cancer screening uses low-dose CT to identify nodules, which may then be triaged to appropriate follow-up intervals or referred, when required, to specialist review for further investigations. The Australian and New Zealand Society of Thoracic Radiology has been privileged to work alongside the Department of Health, Disability and Ageing, the National Aboriginal Community Controlled Health Organisation, Cancer Australia, our respiratory physician colleagues in the Thoracic Society of Australia and New Zealand, and other key stakeholders to develop comprehensive guidelines to support radiologists to deliver this life-saving service. The last 18 months has seen the development and publication of guidelines supporting the national program, including those for low-dose CT acquisition, the nodule management protocol, the structured clinical radiology report, and guidelines around the reporting of non-noduled additional findings that are seen on these scans. A comprehensive suite of educational material has also been produced, which many of you will be familiar with, including a webinar series, multiple in-person workstation-based workshops, and a full series of e-modules available on demand to cover all aspects of reporting for the program. Join me in celebrating this landmark occasion. The moment at which screening for lung cancer occurs is the very moment when the eyes of Australian radiologists are on these scans. Through this tremendous initiative, we can all be part of saving the lives of Australians.